time has concluded. The member for Braddon.
Thank you, Mr Speaker. I would like to add my support to the proposal of a standalone headspace centre in Braddon. While headspace currently services Devonport through an outreach centre, the demand is so significant that the service is limited to just one part of my electorate of Braddon. Since opening in 2013, the service has seen an increased demand for its services in the critical area of youth mental health, and under the current model, outlying areas such as Circular Head and the West Coast are missing out on this vital service. I therefore offer my support to Primary Health Tasmania's proposal to establish a standalone centre on the North West Coast. In its proposal, Primary Health Tasmania has wisely indicated it needs to work with stakeholders on the best place to establish a centre to ensure it effectively services the region. The demand for such a facility is certainly evident, especially considering there were 801 occasions of service by the Devonport Headspace Outreach Centre staff in 2015-16 in the Devonport catchment area alone. Headspace is all about early intervention and works in 4 key areas affecting young people: mental health, physical health, work and study support, and alcohol and other drug services, and also provides information and support through its website. According to Headspace, 1 in 4 young people have experienced a mental health issue in the past 12 months, which is significantly more than in all other age groups. And while it is still difficult for us to talk about, suicide remains the largest cause of death among young people, accounting for 1/3 of all deaths. Since its inception, Headspace has provided services to more than 255,000 young people through its centres, online and phone counselling across the country. Headspace centres are different from other clinical services in that they are designed and built with input from young people and provide access to a range of health providers, including GPs, psychologists, social workers, alcohol and drug workers, counsellors, vocational workers or youth workers. They are also very effective. Headspace reports that more than 60% of its clients demonstrate significant improvement from using its programs. The remaining 40% are still working with Headspace or alternative services. And to ensure they are where young people are, Headspace also branched into the online space with eHeadspace, which provides access to services and sessions to be delivered online. As of March 2016, 55,390 young people access eHeadspace, resulting in 185,459 sessions serviced by eHeadspace mental health professionals. There are more than 12,600 young people in Braddon between the ages of 15 and 24 who could benefit from having access to such a service should a centre be in this area. I note the health sector has been pushing for a dedicated Headspace facility in this area for some time, and it would certainly complement a number of other services. Of course, the federal government has a role to play in this proposal. Both existing Headspace centres in Tasmania are already stretched, and while they do their best for their clients, an expansion such as this will ensure that young people in Braddon have access to this vital service. While current funding limits the extension of the current service, additional funding would allow the integration of this standalone service on the North West Coast with other services. This would see Headspace working in tandem with other programs, including Primary Health Network's responsibilities for chronic and complex youth mental health services. I trust the Federal Health Minister looks favourably towards this proposal and considers funding for a health-based centre in my electorate of Braddon. This would be well supported by the community and families in my region. Thank you.